Alright, so now we're going to go over how to set up your Belmont, our rapid infuser. So we have our machine here, and we have our dry tubing that goes with it here. And we have our fake blood that we're going to prime with later. So the first thing we're going to do is attach our Belmont tubing to our machine. We're going to open this door up. We're going to put our heat exchanger right here in the middle. We'll put that first to kind of give it some balance, make it easier on us. And then you can see the red lining coincides with this red lining. This chamber will go on this yellow dot there. And then just follow the lines here and make it pretty easy for us to follow. All right, and then when we come up here, this knob right here will go inside this area. And this will kind of lock in place, kind of make sure everything's snug and aligned pretty well. All right, and then we can go ahead and close this door, like so. All right, once you have your internal tubing in place, we're gonna put this chamber on our chamber ring. So this will just lock in place like that. Important note, whenever you're placing it there, you wanna make sure that you don't place it too low to where it's kinked right here, because then it won't give you the optimum flow rate that you want. You wanna make sure it's nice and stretched out. Not too much, but there's no kinks. So once we have all of our Belmont tubing connected, we're then going to start priming it. So there's a button back here, we'll turn it on. You'll see the screen pop up. Give it a few seconds. And it'll automatically give us our priming option there. But before we do that, we're going to spike our plasma light. So we have 3 ports right here. These 2 we like to use for our blood products, and the singular one will be for our fluid, our plasma. So we have our 1,000 milliliter plasma. That, of course, sterile technique. Okay, so that's filling up. We'll wait till it's all filled up. Okay, then we'll go to our priming option. Press prime. And this is priming our internal tubing. After, we'll prime our patient tubing down there. Okay, once your internal tubing is primed, it'll show system primed. And then I want you to prime our patient line. So we're gonna hold this down. And then this bottom tubing is gonna be priming. So make sure you hold it down. Get all that air out. Okay, so that's all primed and ready to go. And when your patient line is primed, then you just press this stop button right there. And it'll hop up to this screen. Okay, so now your Belmont is primed and ready to go. So now you can connect it to your patient, either a central line or their large bore IV. And once your line is hooked up to your patient, you can go ahead and press infuse, and it'll give you this screen. So the next step is to start hanging your blood products. So this is our fake blood we have here. We're gonna spike that. So you're gonna take your 2 ports here, the other one you'll clamp, the one you're gonna spike. You can open it up, go ahead and spike the blood. All right, so that's spiked. We'll unclamp it. You can see it start coming down. It'll start coming in this chamber. You can go in and clamp your plasma on this step. You just want blood to start going to the patient. So on this bottom left area, this is where you set your infuse rate. So this will raise your infuse rate there. You can see the set rates up here. That's what you want it to be. And the actual rates right there is what it's actually giving. So they should match most of the time. So you can, this Belmont infuser goes really high. It can go up to 1,000 mLs a minute. You can kind of see that, how it's going. And if you want to decrease it, just this bottom button. And over here is your stop button. And then this button right here, if you want to bolus the patient, that'll give you 200 ml bolus right there. And then this button right here will automatically set the mLs to 500 if you want to rapidly infuse the patient right away. You can just press that button and it'll set this to 500 and this will catch up as it goes. Okay, and while you're running the Belmont, you want to make sure that your chamber is always filled up and you're not introducing any air into this chamber. This chamber, it's designed to stop infusing blood altogether. If it detects air and if air gets to about that level, it'll just stop infusing altogether. So it's not going to introduce any air to your patient. But in order to prevent it stop infusing blood, you want to see how much blood you have in your current unit that's running. And then you can also spike another unit. You can see this is already running out. So you can go ahead and open your plasma light so we never have any air going to the patient. Go ahead and clamp your blood products. Because if you don't clamp it, you see that black backflow coming up. You can go ahead and take this off. You want to flip it upside down, just so you don't make a mess of everything. It's clamped, so it won't start coming out. I'm going to take that off, set that to the side, and you're ready to spike another unit. And then you go ahead and unclamp that, and then clamp your plasma to make sure that it's just blood going into the Belmonts. And like I mentioned before, we have 2 ports here. So in order to save time and not run out of any blood going into the Belmont, you can have both ports spiked, but you want to have one port clamped. And when this blood product runs out, you can just open this up right away, clamp this part, and then open this port. And once you're done transfusing blood to the patient, you can just go ahead and press the stop button right here, and it'll stop giving blood. And then when your patient's done with the case and you're out of the OR and you want to clean up the Belmonts, you want to first make sure everything's clamped first, so you don't have a big old mess. So this is all clamped. The patient tubing is clamped down here. And then you'll just open it up and take it off, turn it off, and then put all the tubing into this red biohazard bag.